Darryl Borsato's journey living with ALS has been one filled with lots of surprises and turns. The first one starting with how he found out ALS runs in his family.
I was put up for adoption when I was 6 months old, and I didn't actually find my birth family till I was 41, at which point I was confronted very abruptly with my mom having ALS in her final days. In fact, the day that I met her, she passed away.
Not only did he lose his mom, he also found out he inherited a rare familial form of ALS, containing a genetic mutation called SD01 that gave him a 50% chance of having the neurodegenerative disease.
It's a tough journey to face. I mean, knowing that you have a disease that is going to take your life somewhere between 2 and 5 years on average from the onset of your symptoms. It hits you upside the head pretty hard.
The reality Dr. Cashman has witnessed with patients in his almost 40 years of experience as a clinician scientist.
SD01 mutations are a really rare cause of ALS, 2% of all ALS, but you can imagine the impact of having a dominantly inherited gene in a family.
Mine started in my right foot, my mom started in her right foot. And it slowly progresses, so you can feel it working its way up your legs, taking muscles, killing motor neurons, basically choking out the muscles that allow you to walk.
This is a big blow to someone who is an avid boxer and overall active person. But thanks to ankle-foot orthotics and a cane, he's still able to push himself where he can, all the while strengthening a new muscle that ALS requires.
Acceptance is a huge part of the process with dealing with this disease. And grieving, learning to grieve the person that you once were, because you're never going to be that person again.
Today, Darryl channels his energy to help advocate for ALS patients in BC, who currently have no options for treatment in the province. Although there is a promising drug for his specific gene mutation, he's finding hurdles in the provincial medical system.
I have 3 neurologists across the country that are all willing to administer it. The problem is I don't live in their provinces. So I need to get BC Health now to approve paying for me to go get medical treatment in a different province, primarily because we don't have the resources here or the staff to do it. And knowing that you're losing your ability to move while you're trying to fight for a treatment for this disease is nerve-wracking. It's really frustrating.
Michael Newman, Global News.
And if you would like to support Project Hope, you can donate at alsbc.ca.